So, my friends, without further ado, let us begin this conference. Um, I've been doing clinical medicine and medical journalism since 1983. When I graduated from medical school, I had the opportunity of starting to work on a local newscast, Canal 4, Guapa. And it's been a long way, baby, as the phrase goes, in terms of how we started being very hesitant about cannabis and how cannabis has come into being an art and a science, because we all wanted to be better as an art and better as a science, and that's why we are joining forces together and talking today. I want to give my biggest thanks to Mico Perez, who brought me to this conference. She's a great collaborator. For me, as I'm concerned, she's the greatest educational ambassador of medical cannabis, and California should be very honored by her presence. We have worked in the area of medical cannabis and autism, trying to create a protocol. So let me give you a sense of where we are standing in state of affairs in Puerto Rico. We have about 216 dispensaries. About 25% are in the capital, in San Juan. They're doing a little bit. The competition has gotten stiff because we have opened too many dispensaries. So now the pound that at 2016 was at 4,500, it's going for about 1,500. We have about 1,000, 4,000 patients, where we expected to have at this time about 250,000. And that has happened because a lot of people, they have not renovated. They have come into the program. I think we have registered about 190,000 patients, but we have lost about 70,000 because of many issues that obviously I will inform you and will give you some suggestions of how we deal with it and how you guys deal with it. We have right now about 188 doctors that have been trained and certified to provide medical cannabis recommendations, but we don't have no universal guidelines or recommendation standards, and we have no obligatory observational studies in terms of outcomes. I treat about 5,000 patients. I've treated. I have trained about 800 physicians, and we're really trying to go beyond the anecdotal evidence, quote unquote, that is on Lively, to an evidence-based practice. And obviously that is a challenge that we have. We work a lot with the sweet spot goal paradigm, where we tell people everybody has its own sweet spot, an amount of THC and CBD, a proportionality. So minor cannabinoids might be very important, CBG, CBN, and the terpenes. We tell people, terpenes are essential in the entourage effect, and you always will be combining a fast administration of your medical cannabis with a sustained formulation to get that 7x24 alleviation. So what I would like to share with you is these 4 points. How do we start with having laboratory precision and quality? And that boils or crosses over into having standardized formulas and an essential inventory of products that should always be available. How do we tie down that to observational research when we prescribe our cannabis? And how do we do therapeutic integration? As you've already garnered from my music therapy, I go beyond medical cannabis, and not only integrating it into non-pharmacological therapies, but very important, integrating it into the armamentarium of therapy that patient has regarding other specialists, physiatrists, neurologists. This is very important. This is one area where we need to collaborate in order to make cannabis a viable medical option. So let's start with quality laboratory testing. This is very important. And here We have in Puerto Rico 4 labs. They're all regulated. The market needs right now are supplied by those 4 labs, so it's a competitive environment. They all have to have ISO 17025. They're not all of them have it. The only 2 of them, but it's supposed to be in the book that you have to have it. There's some controversies that I want to set, like what's a batch size upper limit? Should we be doing 50-pound batches, or should we limit it to 10 pounds, 20 pounds? Okay, I think we're underusing the full certificate of analysis benefits. We are obviously seeing, as you folks are probably seeing, that THC content reigns supreme. That's kind of what everybody wants to have, beyond just telling you don't have crap on your stuff. You don't have garbage. CBD, high CBD THC strains are highly underused in Puerto Rico. We have to fight continuously to get them on the market and educate. And again, I'm sharing this because I feel that the lab should be our strategic partners in moving forward in regards to filling in these gaps. I think every lab here is doing about 50 to 100 batches of flower plus products per month. And as I said, I think labs should spearhead dosing recommendations and the research agenda. I, for example, always tell people that, the full certificate of analysis benefit, for example, one that people do not sometimes consider, and it's very important, is the total terpenes. As you probably remember, any flower that has a total content of terpenes beyond 2%, it's probably a very balanced, interesting flower. So I always tell people that you need the full bouquet of possibilities in the flower, not merely your high THC strain. Okay, so obviously there's a lot of things that we can do in the labs. I think that the labs are going to move to not only identifying substances content, but doing some chemometrics to be able to establish what type of strains are or what type of chemical composition, which is at the end of the game what we want. It's, as we all know, it doesn't mean a thing if we're just saying blue dream, and that blue dream has a certificate of analysis that it's all over the place. So we need to think about this issues like terpenoid clustering, the relevance of terpenoid clustering, and just want to mention here that I feel that this study done and published in 2019 from dispensaries in Nevada was very, very elegant in showing that you could classify flowers just by 3 types of terpene aggregation. For example, type A has 1A has beta-myrcene, alpha-pinene, limonene, and beta-caryophyllene. So I feel that this is one of the responsibilities that we're going to carry as an industry, and you guys are, and you folks are going to carry as labs, to be able to move forward this sort of work. As you can see here, those 3 clusters, we can bunch most flowers in those 3 categories. So again, we're using classifications of flowers by terpenes, and again, trying to see, and this is why this whole dialectical conversation between the labs, the dispensaries, the growers, the clinicians, and the patient is so important. And I am really trying to move forward in that regards in Puerto Rico. I think it's very important to understand that why people do not renovate medical cannabis license in Puerto Rico. And as you can see, the main concern, and this is where the labs can make a difference, they feel that they're disinformed, that they got psycho-intoxicated, that they can't get a consistency in product, and that products were ineffective. So this is some of the things that we have to take into consideration. Now, in regards to standardized formulary and essential inventory, this is very important. I still feel that we're in the Wild West here in terms of, what we prescribe. So it's very important to create what I call a standardized formulary that is based on literature and local expert recommendations, and an essential inventory of products that we predict by experts and patients' advice that seem to be very efficacious. So I feel that that's very important. Those dosing guidelines, we should be disseminated. I think the lab could do a lot of work here. This is, for me, the two articles that I use, the Russo-McCullough article in 2019 and the recent published article on the consensus recommendations on dosing and administration of medical cannabis to treat chronic pain. Okay, so we can see how this protocol makes sense and we should be promoting it. You should start with CBD administration, and once you hit a 50 milligram ceiling and there's no alleviation of symptoms, then you can bring in some THC at a rate of 2.5 milligrams initially, increasing every 2 or to 7 days. So that is very important. We should have a very specific recommendation. For example, this is a formula sheet that I share with the dispensaries when I am prescribing cannabis. For example, just starting from the most sold strains like Blue Dream, Sour Diesel, Girl Scouts Cookies, OJ Kush, Granddaddy Purple. We have here Cherry Wine, which is a local high CBD strain. So again, we should articulate with the support of the lab this sort of very specific recommendations. Here, it's a formula that I have developed in order to combine a sustained release in a rapid effect prescription formula that could be eventually granulated and researched, because again, as you know, we must understand and do some observational research and education, and obviously we got to take a springboard from the NAS study of 2017. I'm honored that Doctora Margarita Alegría from Harvard, a good Puerto Rican friend, was in that committee. And again, the committee says that there's barriers to cannabis research that we have to address. And as it says here, a diverse network of funders is needed to support cannabis and cannabinoid research that explores the beneficial and harmful health effects of cannabis use. As we can see here, the first recommendation that they do in regards to addressing the research gaps is that we should have a comprehensive evidence based on the short and long-term health effects of cannabis from a garnering of public agency, philanthropic and professional organization, private companies, and clinical and public health research group should provide funding and support for a national cannabis research agenda that addresses these key gaps. So we need to improve the research quality of what we do, and I think labs could help us here. We can see here that there's very strong evidence for the efficacy on medical cannabis on chronic pain and post-traumatic stress disorder. These are the quadrant here. So we should, and for epilepsy, there's a lot of studies. So we need to keep improving our surveillance capacity, and that's why I feel that we need to have an obligated surveillance database that garners, what did we give the patient, what happened, what was the outcome. So I think there's a lot of opportunities. I have done a lot of research on my practice, on my 5,000 patients. This is gives you a sense of the breakdown of patients. And interestingly, we have a older elderly population. Most of my patients are above 50, and these are the conditions, mainly chronic pain, insomnia, fibromyalgia, depression, and anxiety make the bulk of the people that I see. And obviously, I have measured the response of medical cannabis with other interventions like mindfulness and cognitive behavioral therapy that I'll talk very briefly. So there's a lot of data that we could accumulate that is very important. We have done this for example, the autism program, where we have combining medical cannabis with mycopers with other interventions like analysis of behavior, ABA behavior. So this is, I think, is very important. So finally, I just want to say we need to do some therapeutic integration. That therapeutic integration is very important. Medical cannabis thrives on knowledge aggregation and collaboration. So to give you a sense of what we do in my clinic is that we have a model for mood, pain, and sleep disorders where we combine cognitive behavior therapy with somatic body therapeutics like yoga, pilates, joyful exercise. We combine it with synergistic nutraceuticals like melatonin, SAMI, curcumin, and boswellia to increase the efficacy of pain modulation. So again, we have models, we have ways of teaching patients. We use a lot of, we use Buddhist teachers and meditation teachers to help our patients. Again, we combine things like Mediterranean diet, olive oil, probiotics to improve the endocannabinoid system. And we give them with every visit, they have some challenges and tasks that they must do. So this is what we're trying to do in regards to building in that integration and providing the best of care. So I hope this has served you to give you a sense of where we are and what we can do for our patients, how we can collaborate all together. So it is an honor for me to have shared with you this presentation, and I hope that together we keep on improving, raising the bar of the art and science of medical cannabis. Bendiciones.